CoreSense has the ability in the future to address a number of challenges. Our primary focus initially is in the emergency department. About 6% of the people who present to the emergency department globally have a chest pain. But actually the vast majority of those people don't have a serious heart event or cardiac event. And CoreSense will have the ability to help physicians identify those people very early in the process, saving them anxiety, but actually saving significant resources and cash within the hospital systems. If we were to put just one device in each emergency department globally, that would be around a £4 billion market opportunity. Now today, there are no technologies available to a physician in the emergency department that does quite what CoreSense will be able to. The key milestones around Creavo are quite interesting. So the technology and the knowledge of the ability for magnetic fields to be diagnostic has been around since the mid-70s. But the technology has never been around to be able to commercialize that and get it into a busy hospital department. Our first application clearly is in the emergency department. It actually is the most difficult area of the hospital to be able to detect these signals and provide a diagnostic capability. So once we've proven ourselves there are a whole raft of other areas of the hospital, both around detecting ischemia in patients and looking at the electrophysiological applications of the heart. So far we've identified 9 other applications, which really in total is around a £20 billion market opportunity. Our initial goal for the company is to build on the evidence we have from our large clinical studies in the emergency department. But beyond that, having addressed that initial market opportunity, there is a large number of clinical data that's already in the public domain that would indicate that we have applications throughout the hospital. So the goal of the company is to build on that clinical evidence and actually bring diagnostic information to a wide range of physicians and patients throughout the healthcare system. The next 5 years is going to be really interesting for Creavo. We've already been called the first new imaging technology since MRI, and we see ourselves as a new imaging technology that can be used throughout the hospital. So we have a number of areas where we're focused in terms of early research, but we see ourselves as being able to provide diagnostic information throughout the healthcare system.